Good morning, everyone, or good afternoon, depending where you are. Welcome to our webinar, Allied Health Made Easy, How to Tap into this growing market. We're thrilled to have you all here with us today. This session is packed with so much valuable information, whether you're new to writing allied health or looking to just sharpen your expertise in this space. I'm Lexi Johnson. I am our professional liability underwriter here at CID Insurance. So I'll be helping to guide you through today's session and want to welcome you here. We're very excited to co-host this webinar with a great team that I want to introduce. There's Adriana Santoli. She is the AVP of Underwriting for Allied Healthcare at James River. We have Taylor Maddox, who is the Allied Health Underwriter at James River. So we're very lucky to have them both on this webinar as they are experts in this field. And then behind the scenes, we have Jacob Cole, who is our marketing coordinator here at CID Insurance, making sure everything runs smoothly behind the scenes. So just a couple webinar logistics. I'm sure you're all very well familiar with our webinars by now, but in case you're new, just a couple of quick housekeeping items before we dive in. All participants are muted by default, but your voice is still very important to us. So you can submit any questions throughout the webinar using the chat function, and we will stop throughout the presentation to answer your questions. If we don't have time to answer all questions, as you know, we try to be mindful of everyone's time, we will reach out to you after the webinar with answers to your questions. And lastly, after the webinar ends, a short survey will pop up. We really would value any feedback, would love for you to take a moment to complete that. All right, we're gonna jump right in. So here's our webinar objectives. Here's what you can expect to learn in today's session. You know, what type of businesses fall under the allied health umbrella and how you can start writing more of this business. Our goal is we really want all of our agents to become more comfortable writing allied health, as there is a huge growing opportunity in this field. We're going to go over some important coverages that these businesses should seek and what's typically required during the underwriting process, what we would recommend collecting from your clients. Then lastly, if you're new to allied health, we'll point you toward the easiest classes to start with and target. So let's start off. You know, what is allied health? We just want to start off by defining what this is. Allied healthcare is a very broad term that includes a variety of healthcare services and providers. Most insurance programs in this space focus on standalone facilities. So this is your non-hospital owned or operated. And it's the facilities that deliver specific services directly to clients. So whether it's a home health agency, residential care facility, or an outpatient clinic, the allied health category covers a wide and diverse spectrum of business types, which, you know, makes understanding the nuances really important. And I just want to start off by going over the current state of the allied health market. There's a lot happening in the allied health insurance space. We're seeing some carriers exit the market, which in a sense creates new opportunities for brokers who understand the classes. But at the same time, there's been a surge in organic growth across the industry, making it a great time to get involved if you haven't already. So simply put, you know, now is the perfect time for agents, brokers to lean into allied health. This really could be a key opportunity to generate revenue for your agency. So just to dive right into, you know, the opportunity with allied health. Allied health is a growing market. It's driven by an aging population, advancements in technology, and increasing healthcare needs, which is all indicating a significant job growth in the coming years. So allied health professionals are a key part in this expansion. Healthcare continues to be one of the fastest growing industries in the US. That means, more startups, more new ventures, and more companies seeking coverage for the first time. And I mentioned a couple of them, but some of the biggest drivers of growth is the aging baby boomer population, the ongoing expansion of telehealth and virtual care, and the booming anti-aging and wellness industry, which we've seen a huge increase in. So these trends are definitely not slowing down, which is why allied health is such an exciting opportunities for producers right now. So I want to just dive in also to some allied healthcare coverages. This slide does not include all coverages that we would recommend, but it is a good starting point of what direction to go into if you are new to writing allied health. So nearly every allied health organization has both a general liability, your GL, and professional liability, your PL exposure. Some people may think, GL is enough, but having just a general liability policy in place alone is not enough. If your clients are relying on having only GL coverage, it can create, coverage gaps and can leave the clients underinsured. So having a professional liability policy is crucial for, any allied health professionals because it is intended to protect them financially from any type of potential lawsuit or claim that arises from an error or omission or negligence in patient care. And just want to mention most of these policies are written on a claims made and reported basis. Something to note is these policies, they come with specific claim reporting guidelines. So it's very important as the broker that you're going over those timelines and claim reporting rules with your client when presenting a quote. And then lastly, just want to touch on the abuse and molestation coverage. We really have seen a rise in this. Typically, the abuse and molestation coverage is crucial for these type of organizations who work with the more vulnerable populations, which is the elderly, disabled adults, children. So we really have seen a rise in the requirements of having abuse and molestation coverage and more specific limits being required through certain contracts. So again, the slide doesn't include all coverages, but is a good starting point of what direction to go into if you're new to writing allied health and you get a risk on your desk. So we're going to jump into some classes under the allied health umbrella. So without further ado, I'm actually going to pass it over to Taylor.
Thank you so much for that information on allied healthcare, Lexi. First off, I want to start by saying good morning, everyone. My name is Taylor Maddox, and I'm an underwriter with the Allied Health Division at James River Insurance Company. I want to thank you all for giving me the opportunity to speak with you today and help further your education on all things allied health in this market. One of the most common risks that we see in allied health is assisted living facilities and residential care. So just to further explain that, assisted living facilities are long-term residential care options provided for seniors. These homes can accommodate the following acuity for clients. So you may have residents that are ambulatory, non-ambulatory. Hospice services may be provided within these homes, give or take. Usually the states are certifying hospice services being provided at these homes. Unlike nursing home settings, if skilled care nursing is needed, these are provided by third-party vendors. These services typically are not provided by the facility. The market for allied health, we can offer skilled medical care, and the homes for skilled nursing facilities can be underwritten, but usually at a higher premium due to higher level of medical services provided. Another facility that we see is adult residential group homes. These are facilities providing care to adults aged from 18 to 59 years old. These homes usually can accept the following acuities of residents. So usually what these homes are accepting is developmentally disabled residents, intellectually disabled residents, ambulatory, non-ambulatory, bedridden residents, and psychiatric history. So these residents are presenting with a psychiatric history. You also can have youth residential group homes. These homes are designated towards residential care for children or youth. These facilities may be ambulatory, non-ambulatory, and these residents may present with a psychiatric history. So some common claims that we usually see within this market is elopements. These elopements are often tied to inadequate supervision, missed bed checks, failure to secure exits or monitor residents with cognitive impairments. So usually these assisted living facilities are Alzheimer's. These residents have Alzheimer's or they have dementia. So usually within the market, they like to see the alarmed exits. So for example, a facility may not have alarmed exits, resulting in a resident or elder person with dementia eloping from the facility, and then the resident would potentially get harmed. So example, getting hit by a car, eloping to another facility, getting picked up by the police. And another claim example for assisted living elderly homes is usually physical abuse claims. So these may stem from poor hiring practices. So if the facility is hiring caretakers that are not designated to provide care, like RN, like they don't have the certification. These also can stem from lack of staff training or inconsistent enforcement of policies and procedures. Another claim example would be falls. So these are common in settings with low staffing ratios or delayed response times. So these also can stem from environmental hazards or lack of fall prevention protocols. So an underwriting criteria that you will see in the market needed to quote these assisted living homes and residential facilities. Usually every market will require a completed residential application, a 5-year general and professional liability loss runs, and if it's new venture, usually they will request a no known loss letter just to make sure that there's been no operations done or no previous claims. And then usually if there are claims or losses over 25,000, they're going to want details or descriptions of those losses. And without further ado, I will pass the mic over to Adriana, who is the AVP of James River Insurance Company.
Thank you, Taylor. Great job. Hi, everybody. I get to go over the easy ones. I'm the AVP of underwriting for Allied Healthcare, one of them. I have been underwriting Allied Healthcare for about 33, 35 years now. So there's a lot that I haven't seen. One of the classes that I have seen get more involved and grow is home health care. And it's exactly what it says. It's any services provided within the client's home or place that they call home. And it could be from minimal, aids of daily living all the way up to hospice and wound care. They have companies that will come to the client's homes and provide like dialysis within the home infusion within the home. So there's not much else left other than surgical procedures that they can add to be done in a home-like setting. And we, most carriers, including us, we will entertain all levels of services provided within a home setting. Depending on the level of care and the type of care will depend on the rates, the pricing, and the coverages. So can we go to the next one? Yeah, thanks. There are quite a few common home health care claim scenarios that we see. A lot of them are fall-related injuries. You could have a caregiver that's making the client lunch, and the client gets up from the couch and falls and hits the coffee table. Or, it could be lack of supervision. They're just outside on the phone, and a client gets up and falls and has an injury. A lot of home health cares do medication reminders. The higher level ones that have LPNs and RNs, they can actually administer meds. Say it's insulin injections, or it could even be pain management if you're on hospice. Missing those medication doses can result in the client having effects. It could be uncomfortable effects. It could be seizure effects. It could even lead to death if they are not given their medications properly and on time. A lot of claims also just fall under the just being negligent care. And this happens because with all the different levels of care being provided, the family or the person that contracts with the company, they always have a much higher expectation. You might have a companion care agency, which really just goes over and does the ADLs are like helping them brush their teeth, changing their clothes, making their bed, making their meals, but they're not qualified to notice or recognize any changes in health conditions, which can be missed. Even though the families know that it's just a companion, there is always that level of expectation that they should know everything and be able to identify everything. Physical abuse claims, you would think are very common in this industry because it's a lot of one-on-one care, but it is not one that we see most often in this class of business. Generally, they're going to be fall related. Or if, say you have a skilled care agency and they're not properly taking care of a surgical wound or a bed sore wound, and that can lead to further infections, unhealing, of the bed sore, and including, sepsis and death. Same things are needed for the home health care, basically, that are needed for the residential care facilities, completing a home health care hospice app, including 5-year GLPL loss runs, and description of any losses over 25,000 will get you a quicker turnaround time from the underwriters. If we're trying to guess and assume and estimate exposures, well, what do you think that loss entailed? It takes us longer to come up with an estimated pricing, and then we'd have to add a lot of subjectivities to confirm and firm up that pricing. So generally, if you can include those 3 things within the submissions, you'll get a much faster turnaround time. And then we go to pharmacies. Big pharma is big these days. There are several types of pharmacies. You have your common ones that are just your retail community pharmacies. You have your chains like CVS, Walgreens. You have long-term care pharmacies that specifically just contract with residential care facilities, nursing homes, could even be psych hospitals or hospitals. and they provide all of the prescribed medications to those facilities, either on a weekly or a monthly basis. And they pack them in blister packs so that the employees and the professionals that are going to be administering them have them already pre-filled for like morning, evening, and by day of the week. There are specialty compounding pharmacies that you will see, and these are mostly ones that do sterile compounding. There's a lot of FDA regulations on sterile compounding prescriptions, and they're usually sterile compounded when there is not a pill form available. A physician may have written a prescription that has different percentages or a different mix of two types of drugs that are not available on the standard market. So a specialty compounding pharmacy could combine those two into one for your prescription needs. A lot of specialty compounding pharmacies are the ones that compound your IV solutions. This could be for chronic pain. This could be for home infusion. This could be for enteral feeding. It could be for chemotherapy. All of those medications that need to be delivered in a liquid form through an IV will be handled through a specialty compounding pharmacy. Now you can have your retail and your long-term care. They may do some non-sterile compounding, and that doesn't require a lot of specialty rooms, hoods, ventilations, and that's usually like topical creams or mixing flavors for children so it tastes better. So the common claims we see in a pharmacy, if we are writing the GL, is going to be slip and fall, because most pharmacies have a gift store. They sell other things. They sell durable medical supplies and equipment. Some of them may have other products, beauty products, household items. So people are coming in and out and shopping, and your slip and fall exposure is rather large when you just have the public, when you're open to the public and they come in and shop around. Now, for PL types of claims, the most common errors are filling prescriptions incorrectly. A lot of medications have the same or similar sounding names, same spelling, and it's very easy for a pharmacist or a pharmacy tech to grab the wrong bottle to fill a patient's prescription and release it to them. Sometimes they give the wrong dose. Instead of putting it in milligrams, they fill the prescription in grams, which is a much higher dose than what was ordered, and can cause complications and health problems. The compounding issues, which is also a professional liability claim, is going to be it's going to factor in the sterility of the lab and the policies and procedures that are used during this sterile compounding process. One of the most common things is that bacteria got in, or someone didn't turn on the ventilation or close the vent so that it was only within that room, and bacteria ended up getting into the mix of the compounded medications that they're preparing, and then it can ferment, and it taken by the client, it can cause infections, severe reactions, and similar cases, of having a bacteria within the medication that you're taking. And again, the same underwriting criteria. Most carriers, as same with us, each carrier will probably have a specialty application for each class of business. So we have a pharmacy application. Most other carriers have a specific pharmacy application. So again, a completed application, the 5-year GLPL loss runs, and any descriptions of claims over 25 is going to get you the fastest turnaround. Now, we do consider in all the classes that we write, because there are still quite a few, more than what we've gone over today. We've tried to just limit it to these 3 as they're the easiest and most common. We can do startup new ventures as well. And that usually requires a resume of the owner or the director of operations resume showing that they have at least 3 years experience in this industry. I mean, you don't want somebody that worked at a flower shop to come and open a home health care operation without having another qualified person to run the operations on a daily basis. Because the HIPAA requirements that are involved with healthcare, there's a lot of rules and regulations that need to be known and practiced that'll keep the insureds out of trouble.
Okay, I will take it from here. Thank you so much, Adriana and Taylor, for joining and all of the great information that you shared. Before we continue, if you have any questions, just want to encourage you to please type those out in the chat room. We'll be happy to answer those before we wrap up. But now that we've covered some of the common classes in more detail, we just want to take a quick look at our broader allied health appetite. As I mentioned, allied health really casts a wide net, covering everything from long-term care and home health agencies to your outpatient clinics, pharmacies, and social service organizations. So as I previously mentioned, there's a lot of opportunity here, especially with the growth that we continue to see. And we're here to help you capitalize on that and help bind more business. So again, if you have any questions or if you're wondering whether a risk that you're working on fits into our allied health appetite, please don't hesitate to reach out. Again, I'm Lexi Johnson, the professional liability underwriter here at CID Insurance. I'm always happy to talk through a submission, help you strategize, or just point you in the right direction. This space can feel complex, but the more familiar you get with the different classes and underwriting requirements, the easier it becomes to recognize and win these accounts. So as we wrap up, here are your next steps. You can start submitting business right away by sending it to submissions@cidinsurance.com. If you have any questions or need guidance, please feel free to email me directly. My email is on the slide, lexi@cidinsurance.com. Be sure to check out our website. We have a lot of tools, resources, and information on upcoming webinars. So it's really great for you to utilize. And then finally, once the webinar ends, you'll see a quick feedback survey pop up. We really would appreciate you taking a minute to share your thoughts so we can continue making these sessions even better for you in the future. So thank you so much for spending time with us today, and we look forward to partnering with you on your next allied health submission. Have a great day.